We are increasing our student numbers, which is fantastic. We're able to graduate more nurses and help the healthcare system through producing more health human resource personnel to support the shortages that we might be seeing. But that means we have more students now to get through skills testing. How does this look in the laboratory setting from an EDIA perspective to support students who have various needs when it comes from their learning perspective, but also how do we get through testing all of the students? In a 2-hour lab, I still have to get through all the students, but now I have more students in that 2-hour lab. And space, of course, is also an issue. My team and I were really interested to see we're not the only ones across the country. So what are other nursing schools doing when it comes to EDIA principles, particularly accommodations for skills testing? And how are they managing the increase in student numbers to make sure that all of these students get tested, signed off, and then once they get into the clinical setting, can safely execute that skill on a real life human being? So we wanted to see not only what schools are doing through actual websites and conversations we had with various nursing leaders of these schools across the country, but also what is known in the literature. And it was very telling for us when we did the scoping review, because the scoping review was not focused just on the Canadian context, it was international. So we opened it wide and found so many examples of schools struggling about this, but no solution. For our environmental scan, we were really interested in how do you test, not what your opinions are about testing. And so we were able to collect quite a large number of responses as well as from websites. But in total, for an environmental scan, we had over 65% collection rate across the country. So our data is very robust and very strong in terms of the evidence that it brought forward. I always think of what's next. A project is never over. What we are doing now is interviewing TMU students, laboratory instructors, and the lab team, and we're learning from their perspectives. So what is working well? What isn't working well, what kind of an ideal model would look like from their unique perspectives. We're going to do a national study as well to collect that subjective data. So if you remember, I said in the environmental scan, I was really looking at objective data. This is how we test, that's it. I wasn't really interested at that point about the subjective experience in terms of how they felt, but the next step will be collecting that subjective data. And so I really wanted to thank the Center of Excellence in Learning and Teaching at TMU for trusting my team, trusting me, and supporting our work through this grant that we received. It's really brought us across the country, our TMU name, my team's name, and our findings. So I've been doing talks across the country on those two pieces, but people are begging to share their experiences. And so that's where our next phase will be, to collect that subjective data. If you're looking at what are you struggling with every single day as an educator, for example, looking at, a challenge that you might be experiencing, 99.9%, you're not alone. And people in other programs and other institutions across the country are likely struggling with similar things. This particular approach that we use really helped us. Literature, environmental scan, qualitative study, locally studying TMU, people at TMU, and then nationally. But for sure, this type of approach can be applied in any discipline. So get curious and get creative and start exploring.